Hello everyone. Today I will present my analytical report titled Suicide Cases Among Teenagers in Malaysia. This report discusses the growing concern of teenage suicide, the factors contributing to this issue, recommendations to reduce suicide cases, and the importance of creating a supportive environment for young people. This presentation begins with an introduction to the issue, followed by the objectives and problem statement. Next, I will explain the current situation in Malaysia and discuss the major factors contributing to teenage suicide. I will then present several recommendations before concluding the report. Suicide is one of the most serious mental health issues affecting teenagers today. Adolescence is a period of rapid physical, emotional, and social development. During this stage, teenagers may struggle with academic pressure, relationships, family issues, and emotional stress. Without proper support, some may lose hope and consider suicide. Therefore, understanding this issue is essential for prevention. The objectives of this report are to understand the issue of teenage suicide in Malaysia, identify the main causes behind it, recommend effective ways to reduce suicide cases, and encourage greater awareness among families, schools, and communities. Teenage suicide has become an increasing concern in Malaysia. Many young people experience emotional stress, anxiety, and depression but do not seek help due to fear, stigma, or lack of awareness. Without early intervention, these problems may become more severe and increase the risk of suicide. Malaysia has seen increasing awareness of mental health among teenagers. Schools, hospitals, and government agencies have introduced counseling services and awareness programs. However, many teenagers still hesitate to seek professional help because of stigma and misunderstanding surrounding mental health. One major factor contributing to teenage suicide is academic pressure. Many children feel stressed because they want to achieve excellent results. Some fear disappointing their parents or teachers. Constant pressure to perform well academically can affect their confidence, mental health, and emotional well-being. Family plays an important role in a teenager's emotional development. Poor communication, frequent arguments, divorce, or neglect may cause teenagers to feel lonely, unwanted, or emotionally unsupported. A stable family environment helps teenagers cope with life's challenges more effectively. Bullying is another factor contributing to teenage suicide. Bullying can happen in schools or through social media. Victims often experience low self-esteem, anxiety, depression, and feelings of hopelessness. Cyberbullying is especially harmful because it can occur at any time and spread quickly to many people. Mental health problems such as depression and anxiety greatly increase the risk of suicide. Some teenagers struggle to manage their emotions and may feel overwhelmed by life's challenges. Without proper treatment or emotional support, these conditions may become more serious over time. Social media has become a major part of teenagers' lives. Constant exposure to unrealistic lifestyles and online criticism can make teenagers compare themselves with others, leading to insecurity and low self-confidence. Excessive use of social media may also increase feelings of loneliness and emotional distress. Schools should include more mental health education in their curriculum. Students need to learn healthy ways to manage stress, understand their emotions, and recognize why they or their friends need help. Awareness programs can encourage teenagers to seek support before problems become more serious. Schools should provide stronger emotional support by increasing access to counselors and creating peer support programs. Teachers should also receive training to recognize warning signs of depression or suicidal thoughts so they can respond quickly and appropriately. Parents play a very important role in protecting teenagers' mental health. Families should spend quality time together, encourage open communication, and create a supportive environment where teenagers feel comfortable discussing their feelings without fear or criticism. Communities and government agencies should continue promoting mental health awareness and provide affordable counseling services. Suicide prevention hotlines and community support programs can offer immediate help to teenagers experiencing emotional distress. In summary, preventing teenage suicide requires cooperation from everyone: schools, families, communities, healthcare professionals, and the government all have important roles in protecting teenagers' mental well-being. Early support and open communication can make a significant difference in saving lives. In conclusion, suicide among teenagers is a serious issue that requires immediate attention. Factors such as academic pressure, family problems, bullying, mental health issues, and social media influence can place teenagers at great risk. However, with early intervention, emotional support, mental health education, and cooperation between families, schools, communities, and the government, many lives can be protected. Every teenager deserves to feel valued, supported, and hopeful about the future. These are the main references used to prepare this report, all of which provide reliable information on mental health and suicide prevention. The appendices provide supporting materials related to this report. They may include examples of suicide prevention posters, school mental health campaigns, and information about counseling services and support organizations available in Malaysia. These materials help reinforce the recommendations presented earlier. Thank you for listening to my presentation. I hope this report has increased your understanding of suicide among teenagers in Malaysia and highlighted the importance of supporting young people's mental health. Thank you.